Before he got a hip replacement, Mike Johansson found just about any activity brutally painful.
About 70–80% of the time was laying in bed. That was the only way that there really wasn't a whole lot of pain, and I wasn't making it worse.
It took Johansson 6 months to get a consultation with a surgeon.
Then I was told from that point onwards it was an 18 to 24-month wait.
The prospect of waiting that long, in that much pain, sent him looking for options.
I had no idea what kind of condition or anything I'd be like after another 18 months of doing it.
Nearly 140,000 people get a hip or knee replacement each year in Canadian hospitals. Wait times vary widely, but 6 months is considered standard. Private surgical clinics around the country are advertising to patients that they can avoid those waits and get joint replacements done in just a few weeks, if they pay. Mike Johansson spent more than $23,000 for his surgery.
Best investment I've ever made. I don't look at myself as a person who jumped to the front of the queue. I got out of the queue.
Johansson came to this private clinic in a suburb of Montreal, where the surgeons only perform hip and knee replacements for paying patients, and where there's evidence that more and more Canadians are willing to spend the money.
Almost quadrupled the number of cases we did at the clinic in the last 2 years.
After 3 nights.
Diana Mason developed severe arthritis in her knees.
At night, the pain was unbearable to sleep. And I got to the point where, to walk out of my house and go into my car was difficult.
Very, very good.
It took just 2 months for Mason to get into the Duval Clinic. Had she gone through the public system at home in Ottawa?
They told me it would probably be about a 2-year wait before I had the surgery.
Mason had her double knee replacement 3 days ago. She paid more than $40,000. The fees in private clinics are roughly double what the same procedures cost provincial Medicare plans.
These people pay out-of-pocket money and they leave space for people in the public system.
This surgeon says that's not how it actually works out.
What that does is it increases wait times for the rest of the people who are still in the public system because of the loss of resources from that public system into the private system.
Dr. David Urbach says governments could shorten wait lists by putting more money into public health care. Consider this operating room sitting idle on a weekday morning.
It could be used if the hospital had funding, if this hospital had staffing. We could use this to provide all sorts of surgical procedures.
Many Canadians are unaware that they can pay a private clinic to avoid wait lists for surgeries in the public system. Federal and provincial laws generally prohibit charging for procedures covered by Medicare, but there are exceptions. Some call them loopholes. For instance, doctors can charge a patient who chooses to travel from another province.
Not entirely in keeping with the principles of the Canada Health Act.
Clearpoint Health Network, now the largest chain of private surgical clinics in Canada, pitches interprovincial travel to would-be patients. If you're from outside of Ontario, you can pay for surgery at Clearpoint's clinic in Toronto. If you're from Ontario, you'd have to go elsewhere, such as their clinic in Calgary. Here, in the birthplace of Medicare, it just doesn't sit well with Vicki McDonald.
I would be out of the running because there's no way I could afford to do something like that.
McDonald spent 2 years waiting for her knee replacement.
It takes an emotional toll. Because you're in pain. I very much worry about what type of health care is going to be available for those who really need the health care. And those who can afford it can get it. And then we who need it just as bad are getting left behind.
Mike, we're hearing about more and more private surgeries. What's driving this?
Well, in a word, Ian, backlogs. They've now grown so large that people are waiting a year or even 2 for surgery. And so those with money are asking themselves, do I wait or do I spend the cash? And that is fueling demand at these for-profit clinics.
Well, as we both know, this is a very polarizing, emotional issue, and so there's a pushback.
Yeah, because there is a real concern about a 2-tier health system. One for those who can afford to pay to get their care faster, and one for the rest of us. And our reporting on this is already triggering a political reaction in Parliament, and tomorrow the NDP will formally call on the Trudeau government to close the loophole that I talked about in the story.
Okay, Mike, thank you.